Hi, everyone. Welcome to Food Talk with Dani Nierenberg. Today, I get to talk to Amesh Adalja, who is a senior scholar at the Johns Hopkins Center for Health Security and an adjunct assistant professor at the Johns Hopkins Bloomberg School of Public Health. His work is focused on emerging infectious disease, pandemic preparedness, and biosecurity, and he has spoken extensively on the risks presented by avian flu. Thank you so much for being here, Amesh. I really appreciate it.
Sure, thanks for having me.
So I want to just dive right in. Earlier this year, you said in an interview that the outbreak of avian flu among birds, including poultry, is out of control. Can you talk about where we are today? What is the state of avian flu right now?
I wish I could talk about it in more detail, but what we've seen is basically a real dearth of information coming
Mm,
from the federal government in terms
right.
of the avian influenza outbreak on poultry farms, on dairy cattle farms. So we don't really know. It's a lot of this is now we're sort of blind. What we know is that the H5N1 virus is widespread. It's affected multiple poultry farms, multiple dairy farms, has infected dozens of humans. But right now, we don't know exactly what's going on the ground. There are some indications that it might have slowed down, but we're not getting the same level of briefings that we had in December or early January, for example. So it's hard to know, but suffice it to say, it hasn't gone completely away. And there are
Mhm.
still concerns that we don't have the proper mechanisms in place to detect any kind of change that would be hazardous for human health.
Can you talk about, the information that was available before the Trump Vance administration took power?
Well, what was happening? So I would say that even during the Biden administration, it wasn't great. This was mismanaged through the Biden administration as well. This was something that Secretary Vilsack, who was the agriculture secretary for President Biden, had said that this would burn itself out, which was
Mm,
clearly wrong. That was clearly
hmm.
misinformation. Nobody believed that that was going to be the case. But what we were seeing were a lot of um, calls, for example, with subject matter experts. So I used to be part of a call with the deputy CDC director, and a group of other people could ask questions and get briefings ahead of time. Press conferences were occurring, a lot more tracking of numbers and day-to-day types of updates were occurring. It just seems like that's not really been happening. At
Yeah.
least I've not been invited to any of those. And some of my colleagues have also said that there's just a lack of information about what's going on. We're seeing trickles of information. For example, when a new farm gets positive results, for example, in dairy cattle, we hear about that, but we don't necessarily hear about an aggressive response. And my understanding is yet that the U.S. Department of Agriculture is doing things now
Mm.
that they have kind of a proactive stance, but less so from Health and Human Services, at least from what I've seen in the reporting. But again, it's a little bit of a black box what's going on right now
Sure.
when it comes to public health preparedness in this administration.
Staying on the administration for a minute, Secretary Rollins, the USDA secretary, has said that she's pulling the idea of mandatory poultry vaccines off the table. Can you talk about what that means? Is that a good approach, a bad approach?
I think it remains to be seen. So there's a lot of controversy and back and forth over the efficacy and the trigger needed for poultry vaccines. One of the things that really colors the way people think about poultry vaccines is that we've kind of got trade barriers that certain countries will not accept poultry if it has been vaccinated. And that's always played a role in how much enthusiasm there was for poultry vaccination. But certainly, certain countries like France have started to use these
Hmm.
poultry vaccines. And they've also faced bans in. I don't think you can get French chicken in the United States now because we have one of those bans on vaccination of
Interesting.
poultry. So that's part of it. But I think that when you think about decreasing risks to humans, poultry vaccines need to be studied in that manner. And certainly France, I think, has had a good experience with it, but I would defer to veterinarians and agriculture
Sure.
experts about it. But there's also this trade issue that plays a role. But I think that we should be thinking about poultry vaccination. We should be thinking about cattle vaccination
Hmm.
as well.
Absolutely. You mentioned former Secretary Vilsack, said that the virus would burn out. The Secretary of Health and Human Services, Robert F. Kennedy Jr., has concerned public health experts by suggesting that bird flu should be allowed to spread through flocks. What kind of dangers does that pose?
I think allowing it to spread is just going to amplify the virus. It's going to allow it chances to mutate, and it's going to expose more people that have to deal with culling operations. This is not a benign illness in poultry. These poultry die, they get sick. So it's not as if this is something that you can just let it go through a poultry herd and
Right.
nothing happened. They have to
Right.
dispose of the carcasses. Some of these birds will bleed. They'll have other problems, and that exposes the humans that have to deal with it, and the other animals that are present
Right.
on a farm. So I don't think that this makes sense. I think that that's not really well thought out, and I think that's not what we want to do. I think what we want to do is use tools like
Right.
vaccines
Right.
strategically, and we want to make sure that we kind of decrease that risk at the human poultry interface.
Are you surprised that this issue that, of preventing avian flu or fighting the virus has become so politicized?
No, this is anytime you have an infectious disease involving agriculture, it's always going to be politicized because it has major trade implications. So we've seen that, for example, when it comes to mad cow disease, and there was a lot of politics over that that's occurred. We saw it during 2009 during the H1N1 pandemic when there was swine infected. That there was concerns about bans of swine that were occurring, and we even during this outbreak when it was in dairy cattle, we saw the country of Colombia ban the importation of U.S. beef, even though this isn't even affecting beef cattle. So this is something that definitely intersects with politics in
Mm.
a way that's kind of unique when it involves an agricultural commodity like poultry, like dairy cattle, like milk, like swine. All of those always raise the stakes when it comes to the politics.
Amish, can we take a step back? Because I think for many of our viewers and listeners, they don't understand like this is avian flu, but it can spread to other mammals and it can spread to humans. Can you talk about how, zoonoses can sort of jump that species barrier?
Sure. So first, just understanding influenza is naturally a disease of waterfowl. So it circulates in ducks and geese, in those
Mhm.
swans, all those types of birds that we think of that are associated with water. All different strains circulate there. Most of those don't have the ability to infect humans. Or if they do infect humans, it's kind of a one off infection and it stops. What we worry about avian flu, because if you get the right combination of genes in an avian flu virus, it can take off in the human population. And that's exactly what happened in 1918. The 1918 pandemic was a wholly avian virus. So
Yeah.
that's why we worry so much about it. What's happened with avian flu is particularly this strain of H5N1, it's been around since 1997. It's been infecting birds and sporadically infecting humans. But what changed was that this virus started to move from infecting birds, which include poultry, obviously, and was able to infect mammals. So we
Yeah.
started to see foxes and cats and um, sea mammals like seals, for example,
Wow.
getting infected. And people forget that it sounds obvious, but humans are mammals too. So if
Right.
something can infect a mammal, then there's a good chance that it might have the ability to infect us. And the more times it gets into a mammal and the virus is put under the pressure of being in a mammalian physiology, it will start to mutate to
Yeah.
to be able to thrive in a mammalian organism. And that's what we worry about, that all these mammals are getting infected. Are these steps that this virus is taking to become pandemic prone, to be able to spread efficiently from human to human? So that's the stakes, that these are avian viruses, but they have the ability to change and mutate and recombine and become human viruses. And we want that to not happen. And,
Right.
and that's
Right.
what all this is about.
For prevention, I'm interested in where these outbreaks are occurring on farms. Are they big farms? Are they small farms? Is it everything in between?
I think it's what we really worry about are these big commercial growers where there are a lot of chickens housed together or a lot of dairy cattle housed together. That's what we worry about. But they could happen even in backyard farms as
Mhm.
well. It doesn't necessarily have to be big or large, obviously. So lots of farms, they have this concept of biosafety where they're trying to prevent these types of infections from occurring. And in many ways, big farms might be well resourced and able to do that, but it may be challenging. And little farms, backyard farms, may not see the need for it, or they
Mhm.
may not have the resources to do it. So I think it kind of can hit both. But I think a lot of the factory farms are where we really worry about it taking off, because that's going to expose a lot of humans potentially during the culling operation. But then again, backyard flock, a person might not be, wearing appropriate personal protective equipment when
Right.
their backyard chicken or their single dairy cow gets infected, or whatever it might be.
Do you see sort of resistance or lack of awareness from the factory farm operations that this is a problem, or are they aware and sort of concerned?
I think they are aware. They've been battling different types of bird flu for a long time. So I think that factory poultry farms are aware. I think it was a new thing for dairy cattle farmers
Right.
because influenza is not considered a disease of cows, and it doesn't actually necessarily kill the cows. It just decreases their milk production. And dairy cattle are a lot more expensive, a lot more valuable than a chicken.
Sure.
So that played a role. And I think this was something new for dairy cattle farmers, whereas poultry farmers and swine farmers even have thought about flu and have kind of been apprised of it. Dairy cattle farms, probably this is a first thing for them, and there was reticence because they did not want their farms to be stigmatized by being impacted. They didn't want to have their workers out sick because they were exposed or they were infected. There was concerns about the milk and what happened to that milk. All of that played a role, and I think that kind of hampered our ability. It was the
Hmm.
fact that many farmers were reticent, and many state agriculture departments were kind of running interference in some way
Sure.
for those farmers, including, and that also includes the USDA under the Biden administration, that there was a lot of crosstalk going on to try and protect those farmers. And we never really saw
Yeah.
a full-throated proactive approach to this during the
Yeah.
Biden administration. And there was evidence. I think the Vanity Fair reported about some of the farm organizations were the ones writing the regulations. So there were concerns that this wasn't being taken seriously enough. I mean, and clearly when the agriculture secretary is saying this is going to burn itself out, there's a problem here, a disconnect.
Right. And dairy farms have faced so much, turbulence over the last several years. Dairy farmers are really suffering. I want to talk about the people who have been infected. They're folks who work on farms, right?
Yes, primarily everybody that's gotten infected has worked on farms. We do have some cases, like one in Missouri, one in Florida. There's a Canadian teenager where we don't quite know exactly how they got infected, but the vast the vast majority of people work either on a dairy cattle farm or on a poultry farm.
Farm workers are especially vulnerable. They're facing a lot of issues right now, including, raids from ICE. They come in close contact, but they might, not want to raise a ruckus, right? And report that they're infected. Can you talk about sort of the implications of that?
Yeah, so as you said, there's a lot of disincentive to step forward and get tested if you might be an undocumented immigrant, if you're worried about getting in trouble, if you're worried about having to be off sick and you worry about your income because many of these people are not going to get paid sick leave. All of that plays a role in farm workers not wanting to be tested, especially when the majority of these cases have been mild eye infection types,
Yeah.
not necessarily sick being hospitalized. So there's a lot of incentives to not step forward. And you probably have farmers or the managers on farms telling people see no evil, hear no evil. They're not looking because they don't want to find it. And we've seen anecdotally or heard from veterinarians that there are more people sick than that number of 80 or so that have been infected. So we know we're missing cases, and I think the system is set up to disincentivize people from stepping forward. And certainly now with the increased activity of ICE, that's added another disincentive to step forward and get tested.
Yeah, it's terrible. I'm wondering if we can go back to talking about how federal budgets have been cut. CDC has been cut. The Centers for Disease Control has been cut dramatically. How does this reduce the capacity to sort of monitor and figure out, where this disease will hit next?
Well, the CDC needs people. They need people to be working. They need resources. They need to be able to move and go do site investigations and present at conferences and meet with colleagues to understand what's going on. And if the CDC funding is cut, that's going to be less resources to do this. And remember, the CDC is not just working on avian influenza. They have a major measles outbreak on their hands, probably going to be a record-breaking year. We've got other threats that they're always dealing with day in and day out. And you add that to avian influenza, and then you cut that funding. It becomes really difficult to have them operating at full capacity or
Right.
operating optimally. So what these cuts do is that they decrease the ability of the CDC to be proactive
Yeah.
because they just don't have the resources to do it, and it makes these types of events much harder to understand and much harder to control.
It's really dangerous. In addition, the Trump-Vance administration canceled a 600 million contract with Moderna to develop a bird flu vaccine for humans. What could possibly justify that decision?
The only thing that justified it was the politics of it, because this happened to be Moderna and this happened to be an mRNA vaccine, and there is this unfortunate stigma that's completely unjustified against mRNA vaccines. So they canceled it, not recognizing that, or probably recognizing but evading the fact that this makes us less safe. That in order to be able to be prepared for an avian flu outbreak, we need to be proactive. We need to have vaccine candidates being developed, and mRNA is a really elegant solution
Yeah.
to this. And the efficacy data that was coming out looked good, but the politics on vaccination are what is, trumping, no pun intended,
Right.
the actual need to do this correctly. And I think it's also, paradoxical that this is coming from the administration that did Operation Warp Speed, which is
Right.
probably one of the best approaches, or probably the best approach to an infectious disease emergency. So what we need here is we need, the President Trump of Operation Warp Speed back. We don't need the President Trump that's trying to pander to RFK Jr.'s base in place. I think what we want is Operation Warp Speed for avian influenza, not what they're doing now.
Yeah, well said. Thank you. I'm wondering if you can talk about, like, in a perfect world, if Trump Vance got their shit together and, decided that they would have this Operation Warp Speed, what kind of measures would be in place to prevent the further spread?
Well, first of all, we would need to get a lot better situational awareness. We need to know where this virus is, which dairy farms, which poultry farms. We need to get a better understanding of how many human infections there have been, not just the number that we've got confirmed, but we need to do broader studies, more testing that needs to be done. They could be doing wastewater testing in the bathrooms at farms if they wanted to do it anonymously. So we need to get situational awareness to understand where this is and who it's infecting. Then I think we need to have kind of all hands on deck when it comes to vaccine development, which means mRNA vaccine platforms as well as other vaccine platforms. We need to be thoroughly updating what's going on in the Strategic National Stockpile. There are H5N1 vaccines there. It's a little bit opaque how many there are,
Yeah.
or at least it's not publicly talked about that much.
Yeah.
And we need to make sure that those are updated to match the circulating strain as well. We need better diagnostic testing. We need point of care influenza tests that can distinguish H5N1 at farms so that we can test people quite rapidly. So that's part of what we would be doing. And we'd also be thinking about the role of poultry vaccination, the role of cattle vaccination, the need to really emphasize personal protective equipment being worn by individuals who are doing poultry culling or who are milking cows. All of that needs to be done. So I don't think it's not something that's unknown what they need to do, but it needs to be a coordinated response, and the federal government can lead it, but the states also have to be receptive to it. And what we have seen is that some states, I can single out Missouri, for example, we're not really wanting to be that aggressive with
Right.
looking for, even after, Missouri was the place that had a case in a human who had no contact with dairy cattle, no contact with poultry, no contact with dead birds, but they haven't really aggressively tried to figure out how that person got infected. So I think what we still have that issue is that even if the federal government was doing everything correctly, the states have to actually be
Right.
willing to do it, and some states may not. Some states like Massachusetts tested every cow,
Wow.
every dairy cattle, but other states are not looking or didn't want to look.
So we can't just blame the federal government. We have to get states involved. Can you talk about, so if the virus continues to evolve and infect more humans, what are the implications of that? What would that look like? Do we have another COVID on our hands? What would it look like?
I think the first thing that happens is this becomes endemic in dairy cattle. That's the one thing that we think will happen, and it may already be endemic in dairy cattle. And the more times it infects mammals, the more chance it has to evolve to be more efficient at infecting mammals. And the more it's in mammals, the more closer it's going to be to humans, especially when they're doing culling operations or milking. And there's a chance that a human might be infected with a seasonal flu strain and then get infected with H5N1, and then the two viruses exchange genetic material and something new comes out.
Yeah.
So there's many different paths for this becoming a major human problem. H5N1 has so far been forgiving. It doesn't seem to spread efficiently between humans. It is something that's been around and known since 1997 and has not been able to cause a pandemic.
Right.
So that gives us some reassurance. But if this was I can think of that, in at minimum, this is a trial run.
Yeah.
And we failed this trial run. There's going to be less forgiving avian influenza viruses in the future, and if we can't handle it well with something that's not infecting humans efficiently, I think it would be really calamitous if we had to do this for something that was more dangerous.
Yeah. So we should be worried, right?
Yes, I think that we should be worried because this is happening on the heels of COVID-19, and we're still seeing reactivity versus proactivity,
Right.
evasion versus situational awareness. We're seeing some of those same mistakes play out. Lack of diagnostic testing. Don't look. Don't see no evil, hear no evil. Don't look. Don't tell. Don't.
Right.
That's basically that type of attitude is something we're already seeing with this outbreak after we've all been through COVID-19, where over 1 million Americans died.
Right. Right. I want to talk about the World Health Organization, Amish. In the first days of the Trump administration, President Trump pulled the United States out of WHO. I'm wondering, this is not a disease that will just affect Americans. It will likely spread if around the world. How does pulling out of WHO affect, a response to the virus?
Well, it puts the U.S. on a poor footing because the WHO is the forum where intelligence about these outbreaks are going to be shared. If cases occur in a different country, that sample doesn't go to the US, it goes to the WHO.
Hmm.
So that sample might be used to make vaccines or diagnostics because the US would be behind, and the US manufacturers would be behind because they wouldn't be getting it first. And we would not really be in the loop if things were going on. Remember that the US doesn't talk to every country, and the WHO does have a lot of member countries that the US doesn't have good relations with. And people are much more open in the World Health Assembly or amongst the WHO groups than they are with the US. So I think it really diminishes our preparedness, and it also disadvantages our pharma and biotech companies who are not going to be the first to get these samples. So I think it makes really no sense. Again, it plays politics, and surely there are reforms that are needed at the WHO, especially with regard to the influence of China there. But if the US is not in the WHO, who will fill that vacuum but China? It's more likely to become more China-centric or more China-influenced without the U.S. there. So I don't think that this was a good move, although it might have played well with certain domestic politics. In domestic politics, it's not something that we think that I think is good for the long-term resiliency of the U.S. against infectious disease threats.
Yeah, it's really bad decision making, isn't it? As we wrap up, Amish, I wonder what advice you have to farmers, dairy farmers, poultry farmers, and all of us as eaters about, what should we be doing to sort of protect ourselves?
So avian influenza is not something that is transmitted by eating or consuming food, other than there's definitely a risk for unpasteurized milk. So I would be careful or not even partaking in unpasteurized milk products. But if you're a farmer, I think it's really important that you are aware of what's going on and understand what the best practices are, and be in constant contact with your health department, with your Department of Agriculture, and really be open to the fact that there are actions that you can take that are going to protect the long-term viability of your farm, that this isn't something you want to hide. This is something you want to be proactive about, and you also want to be good to your workers. You want to make sure that they are safe and that they feel comfortable getting tested, because this is how we stop avian influenza from becoming a human problem, is by each human kind of being proactive and really mindful of the fact that this is a real threat, a threat that turned into the 1918 pandemic over 100 years ago. And it's going to happen again. But we've got so many tools now that they didn't have in 1918. It's just that these tools aren't being used optimally, and they're not being used optimally by choice. So we can change the trajectory of this if we actually take those best practices, take those tools, and use them optimally.
That's great advice. It's not if, it's when, right? When this pandemic will hit.
Right. It may not be H5N1, but we will see avian influenza outbreaks that lead to human pandemics in the future. That is an inevitability.
Amish, thank you so much for sharing all this. Where can people find out more about your work?
You can find me on social media at AMESHAA. That's my handle on X and Blue Sky as well. So those are probably the best places to find more of what I'm doing.
Great. Thank you so much. And we'll include that in our show notes and on our website. Really wonderful to have you. Thank you so much for preparing all of us.
Thanks for having me.